All right, President Trump announces a deal that will drop prices for some of the most popular weight loss and diabetes drugs.
This is a triumph for American patients that will save lives and improve the health of millions and millions of Americans. Amazing thing.
Under the new deals with Eli Lilly and Novo Nordisk, certain GLP-1 medications could cost as little as $149 a month if you qualify. Coming on the heels of this announcement, obesity researchers and clinicians gathered for Obesity Week. It's an international annual conference, and this time it was held in Atlanta, where they discussed the latest efforts in advocacy and public policy. And joining me right now to discuss is Doctor of Obesity Medicine, Christina Nguyen. So good to see you.
Thank you so much for having me here.
So this is a big deal, is it potentially? Because it can be very expensive in order to get any, if you get a prescription or you have the okay to use any of these drugs for obesity, for weight loss, or for your diabetes. How much of a potential breakthrough is this for costs to be down like this?
This is a humongous deal, and we're so thrilled that the Trump administration has offered this to patients because it will ensure that millions of America will have this life-saving medication. For Medicare, we've seen that the copay is going to be about $50, which is much lower than it has been before, because patients on Medicare were not ever allowed to have these medications. They were never covered at all. And so patients have to pay cash price for it. So for it to be $50 is a huge thing for our patients.
Yeah, that's a great offering. So initially, really, it was, considered a real breakthrough medication, mostly for diabetes. But the discovery of its use in helping, to promote healthy bodies has been kind of a continued advantage. So is there real advocacy now as a medication that has far-ranging, kind of use?
Absolutely, because it wasn't until 2013 that obesity was recognized as a true disease state. And we've changed the narrative with all the science and research now that, this is a true metabolic disease, and it's not a disease of choice or a disease of lack of willpower. And when we convey this to patients, it really helps them because they've been shamed or have had bias for all these years. And now there's medications that have been developed that will target the biology of the disease. And when patients are losing 15 to 20% of their weight loss, and when their diabetes have improved, their blood pressure's improved, it makes a difference. Definitely makes a difference.
What would you say were the real breakthroughs from this Obesity Week conference? I mean, what were the new discoveries? What are the hot things that people are talking about that offer some real encouragement?
So there's two new medications that have come out. They're very exciting for us. The first one is from Novo, which is the sema, which is cagrilintide and amylin derivative plus semaglutide, and that's a weekly injection for weight loss. The weight loss was about 20%, which is the big deal. And the other one, I guess the hottest topic, is the orforglipron from Lilly, and that is a medication in a pill form that actually will help with weight loss.
And how much of a big difference do you think that's going to make that there would be a pill form versus exclusively it has been about injectables?
Some patients are afraid of using injections, so that will help a lot with just a daily oral medication. And then a few years ago they did have shortages of these injections, these shots, because the manufacturer was unable to make the pens, and that decreased the amount of medications that was available for patients.
With this government shutdown right now and real limitations on data gathering, how do you see it impacting the work that you're doing?
Well, we are going to still, advocate for patients and still treat patients, but we just want to make sure that the patients get what they need.
And among the other things that were talked about during this week, in addition to medications, but other things like snack foods and some other tools in the fight against obesity? To what extent?
Right. So of course we know that obesity is a very complex chronic disease that relapses. So if when you treat it, it's not just the pharmacotherapy piece that is important. There's the nutrition part of it, the behavioral changes that you have to make, the increased physical activity, and of course, anytime that a patient loses weight, we always try to enforce and let them know that protein is a huge deal. We have to make sure you have your protein intake, and there are more type of protein supplements that patients can take, and at the conference, there's I guess there's more variety of protein instead of just the shakes or the powders. There's
lots of good
different types
options.
of foods. Yes.
Dr. Christina Nguyen, thank you so much.
Thank you so much for having me.